So Andreas, we talked about the present. And where does TAVI go from here, this non-surgical treatment of the valve? Where do we take it from here, say in 5 years, in 10 years? Where do you foresee this going? It's grown rapidly and exponentially over the last 10 to 15 years, based on evidence that it's grown exponentially across the world.
Yeah.
100,000 plus 200, maybe 150,000 TAVIs are done every year across the world. So where do you see it going?
That's a really interesting question, because in all the enthusiasm for the procedure, we haven't solved the very long-term problem, right? So we need valves that last forever. At the moment, the TAVI valve lasts as long as a bioprosthetic surgical valve, but not as long as a metallic valve. And more, we implant these in younger patients, younger being 65, 70, 75, patients that will live on for another 20, 30 years, and they will have to have a second procedure. Right? So we need to find material that lasts forever. We need to find preparations that make the valve last forever. We need to have valves that we can replace. You know, all these things, the long-term management, the lifetime management, we call it, of the aortic stenosis patient, that's one really big thing. And I'm sure we're going to solve it. I've seen developments of material that, you know, artificial leaflets that may last forever. But that's hot off the press, and that's science at the moment. And then, of course, what is happening, all the other valves, the mitral valve, the tricuspid valve, we've got implant techniques for that, we've got clipping techniques to prevent them from leaking. I think there will be more and more interventional cardiology, a bit less surgery, but there is progress on all fields, and I'm sure in 10 years we'll look back at this and say, oh, just remember what we'll not be able to do then, and now we can. So
yeah, I think it's a
bright future.
Very exciting area where non-surgical replacement of the aortic valve led into the whole arena of how can we non-surgically also treat the other valves of the heart and other structures of the heart as well. And I think many of the developments, fair to say, have been, you know, in partnership with the surgeons, the cardiac surgeons.
It's all together.
It's a big move forward together in an area which is now a specialization in itself. So it is great talking to Professor Andreas Bombach. Thank you for visiting us in India, Andreas. It was indeed a pleasure talking to you. Enlightening for all, you know, wonderful for you to have us as a friend and partner in both development of science and technology and mentoring transcath aortic valve implantation therapy for India and across the world.
Well, thanks for having me in India. I'm always, I feel very welcome. What we're doing is we're using innovation and technology that comes out of this country, and I think it's amazing, and we will continue to do so and support and collaborate with company and colleagues from this fantastic country.
Thank you.